Dear friends, you must be aware that the government of India has opened up the vaccination for the citizens above 18 years of age from 1st May 2021. This is indeed a positive step towards our fight against corona. I urge that all the eligible people take their vaccination at the earliest available opportunity. The purpose of my making this video today is to talk to you about a very important health crisis, that is the shortage of blood and blood products in the blood banks in India. Due to the fear of corona, people are not going to the hospitals and blood banks to donate the blood. This is causing a lot of trouble for various patient categories such as thalassemics, cancer patients, pregnancy and delivery cases, accident victims, and the patients who undergo major surgeries. This shortage of blood at blood banks and hospitals are causing major health crises which are not getting reported by the media due to the overwhelming focus on the corona issues around us. Friends, do you know that after taking COVID vaccine, you cannot donate blood for the next 28 days? The data says that most blood donors in our country are in the 18 to 45 years age category because they are the ones who are usually eligible to donate blood, since many people in the advanced age would have other health issues that makes them ineligible to donate blood. And the same age category of 18 to 45 years people are going to get vaccinated from 1st May 2021. Imagine a situation where millions of citizens of the 18 to 45 age group gets vaccinated in early May and therefore they are not able to donate for the next 1 month. What would happen to our critical care healthcare system if there is no blood available in our country? What would happen to a thalassemic child whose life is totally dependent upon receiving blood transfusion once in 15 days? What would happen to a lady who is undergoing cesarean surgery and who needs urgent blood transfusion to save herself and her baby? What would happen to a critically injured accident victim who lost a lot of blood due to the injuries and therefore needs urgently a blood transfusion? What would happen to the millions of cancer patients, surgery patients, and other similar patient groups who need blood to save their lives? Isn't that as important as saving COVID patients? Friends, every day we are seeing the heartbreaking scenes of the struggle by COVID patients due to the shortage of medical oxygen as well as shortage of various drugs such as remdesivir, tocilizumab, etc. Our governments are responsible to ensure the availability of such life-saving drugs as well as oxygen by ramping up the production and supply. And I believe that our governments, that is state governments, union governments, and even local governments, are doing their best to help the public by even increasing the production of these drugs as well as oxygen. Even the production capacity of the vaccines have been ramped up to ensure that every citizen above 18 years could lead a healthy life. But can government produce blood? Can government ensure the blood supply to a critically ill cancer patient or an accident victim or a lady who has just undergone cesarean and need blood? If we, the Indians, do not go out to a blood bank or a hospital and donate blood, can we blame the government for not ensuring the blood supply to critically ill patients if we do not go out to a blood bank and donate our blood? Friends, oxygen can be produced in factories. The medicines and even vaccines can be produced in factories, but blood cannot be produced in factories. It has to be donated by one human being to another human being. This is the real test of humanity at this grave crisis. My humble appeal to you, therefore, is before you get vaccinated, please go and donate blood at any nearest hospital or blood bank. In fact, if you are scared of going to a hospital, then you may go to a nearby standalone blood bank where there are no corona patients. And in case you are even scared to go to a blood bank also, then you can hop into a mobile blood collection unit and donate your blood there. Having said that, all blood banks are safe environment. They sanitize their premises, including the donor's couch, before and after you donate your blood. And most apparatus that are used in a blood bank are sterile and for one-time use. And you don't even have to remove your mask while donating the blood. That means you are not at risk at all. And friends, you don't have to wait too long for the vaccination after your blood donation. In fact, you can get vaccinated just 24 hours post your donation. So I urge all of you, go out today itself to the nearest hospital or a blood bank or a mobile blood collection unit and donate your blood before you vaccinate yourselves. Do good to others before you do good to yourselves by taking the vaccine. So I end today by saying donate before you vaccinate. With that, I thank all of you. Bye bye.